Okay, so I just drew this medication, this 0.5 or 0.5% Marcaine with Epi that expires 12 of 2020. I drew it up with my 18 gauge hypodermic needle. Now I need to transfer. We're not going to also inject with this big needle, this hypodermic needle. We're going to inject with the 22. The 18 was simply to draw it up out of the vial. So now, one thing you need to remember is that with hypodermic needles, they should never be recapped. But if you are going to recap it, you must use the one-handed scoop method, which I know has already been mentioned to you. So with one hand, I'm going to affix the cap and I'm going to scoop it. Yep. Scoop it in there with one hand. And then the safest way to remove this is to take a hemostat and simply remove it. This is the safest way to put it on and take it off. Okay? And now, because this is recapped, you can, if you wanted, you could do it this way. You could use your fingers. But the safest way would be to use a hemostat to put it on. So I've transferred this. I've transferred this to my 22 gauge needle. And now I've got to affix my label because I just drew it up. So remember, medications are either poured and then labeled or drawn up and then labeled. 0.5 Marcaine with Epi expires 12 of 2020. And so now when I go to pass this to the surgeon, okay, you're going to pass it like a pencil and you're going to announce it. So the first thing you're going to want to do is remove this cap. The surgeon cannot use this. Now you have to be very careful when you're removing it, okay? Because you want to take it off and just remove it. And then when I pass this to him, I'm going to pass it like this, and I'm going to say, this is 0.5% Marcaine with Epi. You do not have to announce the expiration date. You only need to announce the strength and the name of the medication. This is 0.5 Marcaine with Epi as you hand it to him. And then when he gives it back to you, again, you can use the one-handed scoop method. It's a little bit easier this time because it's kind of sitting up. And I can push it right against something and you hear it snap. And then again, to remove it, I could use my hemostat and simply twist it. This is called a lure lock tip. There's a slip tip and a lure lock. You've got to have a lure lock when you're placing a hypodermic needle like that.
If it is uncapped, you have to use an instrument to remove the needle or place the needle back on there.
Yes.
You can, when it is capped, remove it with your fingers, untwist it, and twist it back on there.
Let's say you get it back from the surgeon, okay? And let's say you got 30 cc's of this. And let's just say, okay, let's say he used 10 cc's of this and he hands it back to you. The safest way and the best practice to remove this used hypodermic needle is definitely with a hemostat. Twist it off and place it in your magnetic strip. If he needs to use it again and he wants to finish up the rest of that, then of course, again, the safest way is with your hemostat.
Can we talk about drawing it back up when it's empty?
Yes, let's do that. I'm going to remove it one more time. All right, the other thing I want to talk about is you always want to make sure, you have to be aware of how much medication you're being dispensed. If you're being dispensed 30 cc's and you're filling up, let's use that as an example. I was just dispensed 30 cc's of 0.5 or 0.5% Marcaine with Epi, okay? I received 30 cc's, let's say I only have a 20 cc syringe on my field. That means I'm gonna have 10 cc's left in the cup because they gave me 30. So I'm gonna draw this up,